Ever pondered what happens when your body overreacts to substances like pollen or dust? This is type 1 acute hypersensitivity at work. It's a fascinating biological process where your immune system, usually your body's trusted defender, starts to see enemies in the harmless. It's like your body's security system sounding the alarm over a falling leaf. This overreaction is triggered by substances we call allergens. They could be anything: a speck of dust, a grain of pollen, a slice of strawberry. It's highly individual. Now, your immune system, in its zeal to protect you, produces copious amounts of a type of antibody known as IgE. These IgE antibodies attach themselves to the allergens and signal your immune cells to release chemicals that cause allergic symptoms. So, these hypersensitivity reactions, although meant to protect us, can sometimes go overboard, leading to discomfort and sometimes severe allergic reactions. How does this hypersensitivity happen? It's like a play with several acts, each with its specific role. Act 1 begins with the initial exposure to an allergen. Think of pollen or peanuts. Your body perceives this harmless substance as a threat and signals B cells, the guardians of your immune system, to spring into action. In the second act, these B cells produce a special type of antibody known as IgE. These IgE antibodies are like tiny detectives, seeking out the allergen that triggered their production. Once they find their target, they bind to it, marking it for destruction. Act 3 sees these IgE antibodies also binding to mast cells, which are found in tissues throughout your body. On subsequent exposure to the allergen, the mast cells recognize it instantly, and this is when the drama really begins. The mast cells degranulate, releasing a flood of histamine and other inflammatory mediators that cause the symptoms we associate with an allergic reaction. So the next time you sneeze or itch after exposure to an allergen, you'll know exactly what's happening inside your body. Now imagine this process happening in your lungs. That's allergic asthma. Picture your lungs as a bustling city, with allergens like dust mites or pollen playing the role of unwanted intruders. These allergens, harmless in reality, are perceived as threats by your immune system. In a bid to protect your lungs, your immune system triggers a type 1 hypersensitivity reaction or an allergic response. The symptoms of allergic asthma are all too familiar: wheezing, shortness of breath, chest tightness, and coughing. These are not random occurrences, but are the result of inflammation. As the allergen invades, your immune system calls in the troops, releasing histamine and other chemicals that cause inflammation and swelling in your airways. This inflammation narrows the airways, making breathing a real struggle. But what happens when this hypersensitivity reaction goes to the extreme? We have anaphylaxis. Anaphylaxis is a severe, life-threatening manifestation of type 1 acute hypersensitivity. Imagine the body's immune system sounding an alarm, only this time it's a full-blown emergency. The symptoms of anaphylaxis are dramatic and immediate. Difficulty breathing, dyspnea, due to swelling and bronchoconstriction can occur. There might be a sudden drop in blood pressure, causing dizziness and potential loss of consciousness. Other signs include a rapid pulse, skin rash, and nausea or vomiting. Epinephrine and fluid therapy may be required to survive. It's crucial to recognize these reactions and seek immediate medical attention.